Unit 10 Test Questions 3 70. The nurse is monitoring a client with a diagnosis of peptic ulcer. Which assessment finding would most likely indicate perforation of the ulcer? 1. Bradycardia. 2. Numbness in the legs. 3. Nausea and vomiting. 4. A rigid board-like abdomen. The correct answer is a rigid board-like abdomen. 71. A client has been diagnosed with gastroesophageal reflux disease. The nurse interprets that the client has dysfunction of which of the following parts of the digestive system? 1. Chief cells of the stomach. 2. Parietal cells of the stomach. 3. Lower esophageal sphincter. 4. Upper esophageal sphincter. The correct answer is 3. Lower esophageal sphincter. 72. A nurse is inserting a nasogastric tube in an adult client. During the procedure, the client begins to cough and has difficulty breathing. Which of the following is the most appropriate nursing action? 1. Remove the tube and reinsert when the respiratory distress subsides. 2. Pull back on the tube and wait until the respiratory distress subsides. 3. Quickly insert the tube. 4. Notify the physician immediately. The correct answer is 2. Pull back on the tube and wait until the respiratory distress subsides. 73. A nurse is assessing for correct placement of nasogastric tube. The nurse aspirates the stomach content and cheeks and contents of pH. The nurse verifies the correct placement if which pH value is noted. 1. 7.5, 2. 7.35, 3. 7.0, 4. 4.0. The correct answer is 4. 4.0. 74. A client has experienced delayed gastric emptying. The nurse determines that which of the following structure is responsible for the client's symptoms. 1. Pyloric sphincter. 2. Cardiac sphincter. 3. Jejunum. 4. Gilium. The correct answer is 1. Pyloric sphincter. 75. A nurse is preparing to remove nasogastric tube from a client. The nurse would insert the client to do which of the following just before the nurse removes the tube? 1. To perform a Valsalva maneuver. 2. To take and hold deep breath. 3. To exhale. 4. To inhale and exhale quickly. The correct answer is 2. To take and hold a deep breath. 76. The nurse provides medication instruction to a client with peptic ulcer disease. Which statement, if made by the client, indicate the best understanding of the medication therapy? 1. The cimetridine will cause to produce less stomach acid. 2. Sucralfate will change the fluid in my stomach. 3. Antacid will coat my stomach. 4. Omeprazole will coat the ulcer and help it heal. The correct answer is 1. The cimetridine will cause me to produce less stomach acid. 77. The nurse is reviewing the record of a client with a diagnosis of cirrhosis and noted that there is documentation of the presence of astrocysts. To assess for the presence of these signs, the nurse would do which of the following? 1. Ask the client to extend the arms. 2. Assess the presence of Hammond signs. 3. Instruct the client lean forward. 4. Measure the abdominal girth. The correct answer is 1. Ask the client to extend the arms.